What's up, my fellow OBGYNs? Today we're going to be talking about cervical cancer screening. And guess what? You're never going to guess. They changed again! In January 2016, ACOG released a new set of recommendations. Some of the changes were a bit shocking, such as primary HPV screening. That has its own dedicated video. Check out the link above. And there were some more predictable changes, like doing away with annual pap smears. Come on now. In 2012, you know the guidelines were a little bit wishy-washy, but in 2016, they grew a backbone. Recommending annual pap smears is a thing of the past. So, let's highlight the key changes. For the most part, the updated guidelines clarify areas that the 2012 recommendations left really vague. Cervical cancer screening frequency. Pap smears should be performed every 3 years in patients ages 21 to 65. Co-testing every 5 years, starting at age 30 up to the age 65. This is the preferred method of screening in this age range. Primary HPV screening is an option every 3 years, starting at age 25. Now, don't go overboard. This screening is meant for average risk patients. Some people need more frequent screening. Obviously, women with CIN 2, 3, or history of cervical cancer, women who were exposed to DES in utero, and immunocompromised patients. Patients with HIV, they actually provided some more detailed guidance for this population, including starting screening at the age of first intercourse. For more on these details, look at the description or check out the ACOG website. So now let's look at some of these special scenarios that they clarified. Case number 1. Say a patient has ascus negative HPV. The suggested follow-up before was routine testing, which was co-test in 5 years. They thought that was a bit extreme, so they know these women are at a slightly increased risk over the general population. So what do? They figured, let's be super duper cautious and bring them back in 3 years. Thank goodness ACOG releases that disclaimer at the top of all of their bulletins that says, by no means is this the Holy Grail. I would seriously have a hard time letting my patients with an abnormal pap smear go a full 3 years without additional screening. Scenario number 2. Say a woman has a history of CIN 2, 3, or adenocarcinoma. She needs to continue screening for a total of 20 years after spontaneous regression or management of that situation, even if the management was a hysterectomy. They're recommending in hysterectomized women cytology-based screening every 3 years for 20 years after. Now, the next situation I hold dear and true to my heart. This is a situation that happens to me on a daily basis. Say the patient does not get routine GYN care and she's approaching the age of 65. The recommendations say discontinue screening at the age of 65 in women with adequate screening. Well, what the heck is adequate screening? Well, now we have a definition. Adequate negative prior screening test results are defined as 3 consecutive negative cytology results or 2 consecutive negative co-test results within the previous 10 years, with the most recent test within 5 years. So, when Mrs. Johnson rolls through the door at the age of 64 and her last exam was in the 1970s, I guess we need to be screening her until the age of 74. This last situation was so in need of clarification. Say the patient's pap is normal, but she tested positive for high-risk HPV. You got a couple options. Option number 1, repeat co-testing in a year. Option number 2, reflex to genotype it. If she tests positive for 16 or 18, she goes straight to colposcopy. If she tests negative for 16 and 18, repeat co-testing in a year. The last question that they clarified is, what do you do with the gals that have had the HPV vaccine? Do you screen them differently? Short answer, no. They get the same complicated screening that everybody else gets. So there you have it. I was really hoping these set of guidelines were going to give me a little bit more guidance on what to do with my patients who have super high risk sexual behaviors, because I barely feel comfortable letting those gals go a full year. Let me know what you think of these guidelines in the comments down below. Subscribe to our channel to tune into our new videos every Monday. And to be on the OwelleMD Inner Circle, subscribe to our newsletter. See you guys next week.